Hello, my name is Val Sparks. I'm the infection preventionist at Midland Memorial Hospital, and I'd like to share a few key topics with you about opening up your practices safely in the current situation of the coronavirus. First of all, I'd like to talk about universal masking. And this can be done with a fabric mask. It could be done with a handkerchief, but all of your patients, when they enter, before they enter your practice, should be wearing a mask, as well as all of your staff members. This mask is easy to put on. You can use a bandana, and it helps us with our social distancing and keeps our coughs and sneezes in check within our universal fabric mask. Now, this is by no means a mask that can be used for procedures or if you're doing cough and producing or aerosolized producing procedures, SVN treatments, or bronchoscopy or anything like that in your offices. But the universal masking is for the staff and for the patients. We need to talk about your families being in the clear. You should only be seeing your patients in your offices. The family can wait in the car. If, however, there is someone who needs assistance getting into your building or into your office, then allow just one other person, significant other, with the wheelchair or whatever. And obviously, if it's a pediatric patient, just one person coming into your office. Again, they should be universally masked. We need to talk about watching the high-touch areas in your offices, the door handles, the push doors, what your patients are touching, whether it's the chair arms or the exam bed. You need to be wiping down those surfaces between patient contacts using a disinfecting wipe for the allotted amount of time. It should be killing bacteria and viruses, and you need to read the instructions on the contact time and how long it takes to kill those viruses. It's not simply a wipe and go. You may need to wipe it for 30 seconds to 1 minute to wipe down those surfaces, okay? You need to encourage hand hygiene with your people and teach them about soap and water, the use of soap and water for 20 seconds, and getting all the surfaces of their hands and their wrists in between their fingers, their fingernails. Maybe those fingernails need to be cut down. In the absence of soap and water, you need to encourage them to use alcohol hand sanitizer. This is between touching those surfaces. Get it, just a dab will do ya. And wipe your hands, the backs of your hands, your wrists, in between your fingers, and rub it till it's dry. Do not wave it in the air or wipe it on a towel, but let it air dry. Again, we encourage you to go ahead and implement these practices in your offices, and hopefully you'll be able to see your patients as much as possible. If they are truly ill, we do encourage the telehealth, utilizing that aspect if at all possible. And by all means, screen your patients before they come in for the signs and symptoms. Temperature is key. We're talking over 100.4 degrees Fahrenheit. If they have cough, runny nose, sore throat, if they have headache, if they have GI distress, such as nausea and vomiting, or severe fatigue that is not explained by any other diagnosis. Thank you.